Hampton Roads is preparing for a battle. EMS teams in Virginia Beach are increasing screening procedures for Ebola and adding protective gear.
Now, it's only a precautionary step in the fight. So far, no one in the area has the virus.
10 on your side's Anita Blanton joins us now with more on the potentially life-saving procedures.
Yeah, absolutely. Tom and Nicole, I talked with Ed Brazel with the Virginia Beach EMS today, and we talked not only about what they're doing right now, but the extra steps that they're taking, but also the added concerns they have as you now see a healthcare worker in Dallas test positive for this deadly disease. Maintaining a standard of care is important. Minimizing exposure to Ebola, though, can be life or death.
And then we're constantly looking at, are there better tools, better things out there to put even more layers on. But
these are the added layers in Virginia Beach.
just put that extra layer to protect your arm and prevent any kind of gap there at your wrist where things can splatter in. And you can even put another glove on over the top to better seal that.
Along with the sleeves and gloves, you'll find gowns, masks, and booties to cover shoes. Full kits of protective gear on every ambulance on the street. Because despite the risk of contracting Ebola being low,
We really want to make sure our providers are confident and comfortable to be able to provide the service, but then still go home safe and healthy.
Brazel says even as they increase protection for workers who could come in contact with infected patients, they're still waiting to find out what happened to a nurse in Dallas who's tested positive for the disease after it seemed for a while everything was being done right. But in the meantime, their protection also now includes new questions asked when you call 911.
If you call and you say you've got the high fever and then some other symptoms, they're going to ask you, have you traveled to West Africa recently?
Their plans in place are similar to when the threat of H1N1 was top of mind, and he says this time of year only adds to their level of preparedness for whatever comes this way.
Is it right now, flu season's out there, and so we're already thinking infectious disease, we're already thinking protect ourselves, so that's a good thing for emergency responders, that we're already in that mode.
And they're keeping the lines of communication open so everyone's on board.
There have been multiple meetings between EMS, fire, health, and just getting the latest information and getting that out there to our folks and working on contingency plans.
He says they're getting constant updates from the CDC, and again, still waiting to hear exactly how that nurse in Dallas became infected. Did she follow protocol or not? That information will help healthcare workers throughout the country tremendously moving forward. Anita Blanton, 10 on your side.